Hi, my name is James, and today you will learn what is premature ejaculation, home treatments and how to avoid. But before revealing these tips, I want to make something clear. These valuable tips will help you a lot if you suffer with premature ejaculation. But they will not be the definitive cure for your problem. They will only help you improve your performance. So if you suffer with this bad and seek the ultimate cure for that problem, I recommend that you visit the site in the description of this video. This is the 100% natural method, which has already helped thousands of men overcome premature ejaculation. So after watching the video, run there and go to the site, okay? And if you're new here, already subscribe to the channel to receive more content on this topic. If you are already registered, do not forget to leave that like, okay? Let the infallible tips on premature ejaculation, what it is, home treatments and how to avoid. What is premature ejaculation? Premature ejaculation occurs when a man has an orgasm earlier than expected during intercourse. If this happens again and again, there is no cause for concern. But if this is a recurring problem, it is important to seek a doctor. According to the International Society of Sexual Medicine, premature ejaculation corresponds to ejaculation that always or almost always occurs before 1 minute of vaginal penetration or that has had a significant and cumbersome reduction in time to ejaculate, often to about 3 minutes or less. If it's your case, do not worry, premature ejaculation is a relatively common problem. Estimates show that 1 in 3 men have this condition. Types. The theme, like all involving sexuality, is quite broad, and so there are different classifications for premature ejaculation. Primary: when from the beginning of the sexual life the man coexists with impossibility of prolonging the coitus. Secondary: when it arises in the life of the individual who controlled well. Situational: in case of only occurring in a certain situation, for example, with a specific partner. Variable: occasionally experiences premature ejaculation. It's not a problem, but a variation of man's ejaculation time. Subjective: premature ejaculation where there is a control time above the limit of 2 minutes, but the patient has a lot of dissatisfaction with the duration of coitus. The use of other techniques such as perineal exercises always plays a complementary role to the basic therapy and can be very useful in that it reinforces the individual's perception of the structures of this region. Causes. The exact cause of premature ejaculation is still unknown, but doctors believe that psychological and biological factors are involved in the motives that led to the occurrence of this problem. Some psychological factors that seem to be involved in premature ejaculation are erectile dysfunction, anxiety, relationship problems. The use of some medications, such as psychotropic drugs, can cause premature ejaculation. The biological factors that may be related to the problem are hormonal levels above normal, neurotransmitter levels above normal, abnormal activity of the ejaculatory system, thyroid disorders, inflammation or infection in the prostate and urethra, genetic factors, damage to the nervous system caused by traumatic experiences of surgeries, risk factors. Some factors can make premature ejaculation easier. C. Erectile dysfunction: problems in having or maintaining an erection, as well as the fear of losing an erection, can lead the man to ejaculate ahead of time. Stress: emotional or mental instability limit the ability to concentrate and relax, which may lead to the occurrence of this problem. Health problems, such as heart disease, can increase anxiety during intercourse and cause premature ejaculation. Symptoms of premature ejaculation. The first symptom of premature ejaculation is when ejaculation happens earlier than expected. However, this problem can happen in any sexual situation, including during masturbation. Doctors usually classify premature ejaculation into 2 categories: primary and secondary. Primary premature ejaculation is characterized by problems identified throughout the patient's life. Look. Difficulty holding an erection with less than a minute of penetration. Inability to delay erection during sexual intercourse. Stress, frustration and the act of avoiding sexual intimacy with the partner. In precocious secondary ejaculation, the man shows exactly the same symptoms of the primary ejaculation, with the difference that the symptoms were not always part of his sexual life. Men who have this type of premature ejaculation have had satisfactory sexual intercourse in the past and have manifested the problem for some reason. Seeking medical help. Talk to your doctor if you ejaculate earlier than you wish during most sexual encounters. Diagnosis and examination. At the doctor's office. If ejaculation happens earlier than expected over and over again, there is no cause for concern. But if this is a recurring problem, it may be time to seek medical help. Do not be ashamed to admit the problem. The sooner you start the treatment, the faster you'll get rid of it. General practitioner. Urologist. Specialists who can diagnose premature ejaculation are. Being prepared for the appointment can facilitate diagnosis and optimize time. That way, you can already get the query with some information. A list with all the symptoms and how long they appeared. Medical history, including other conditions the patient has and medications or supplements that he takes regularly. The doctor will probably ask a series of questions, such as, how often do you have premature ejaculation? When did you experience premature ejaculation for the first time? Do you have premature ejaculation with only one partner or all partners? Do you experience premature ejaculation when you masturbate? Do you have premature ejaculation every time you have sex? How often do you have sex? How much are you bothered with premature ejaculation? How much is your partner bothered with premature ejaculation? How satisfied are you with your current relationship? Are you also having trouble getting and maintaining an erection, erectile dysfunction? Do you take prescription drugs? Do you use recreational drugs? It is also important to take your questions to the written consultation, starting with the most important. This ensures that you will get answers to all relevant questions before the consultation is over. For premature ejaculation, some basic questions include: what may be causing my premature ejaculation? What tests do you recommend? What approach to treatment do you recommend? How long after starting the treatment can I expect the improvement? Am I at risk of having this recurring problem? Is there a generic alternative to the drug you are prescribing? Do not hesitate to ask further questions if they occur at the time of the consultation. Diagnosis of premature ejaculation. The conversation with the doctor is enough for him to make the diagnosis, along with a thorough physical examination and a little more in-depth talk about health history. If the patient experiences premature ejaculation and, at the same time, problems in maintaining an erection, the doctor may request some blood tests to check the testosterone levels in the bloodstream. Treatment and care. Treatment of premature ejaculation. Among the treatments available, there are sexual therapy, the use of some medications and psychotherapy. For some cases, combining these treatments may work better. Sexual therapy. In this case, a few simple measures suffice, such as masturbating an hour or two before intercourse to slow down the erection during the act. Avoiding penetration for a while and discovering new sources of sexual pleasure can also be a way out of the penetration pressure. Tightening technique. The tightening technique is to sexually stimulate the man until he recognizes that he is almost ejaculating. At this point, gently squeeze the end of the penis where the glands meet the shaft for several seconds. Stop sexual stimulation for about 30 seconds and start again. The person or couple can repeat this pattern until the man wants to ejaculate. Last time, continue the stimulation until the man finally reaches orgasm. Stop and start method. The stop and start method is almost identical to the tightening technique. This method consists in sexually stimulating the man until he feels he is almost reaching orgasm. Stop the stimulation for about 30 seconds and start again. Repeat this pattern until the man wants to ejaculate. The last time, continue the stimulation until the man reaches orgasm. Medicines. Antidepressants can be helpful because one of its side effects is prolonging the time it takes to get to ejaculation. However, these medications should be prescribed by specialists, such as urologists or psychiatrists. You can also apply a local anesthetic ointment to the penis to reduce the stimulus. Decreased sensitivity in the penis may delay ejaculation. Using condoms can also have this effect in some men. If distraction techniques cause difficulties in maintaining erection, medications used for erectile dysfunction may help. Seek medical attention. Talking to a professional about the problem can also help. Some therapy sessions can help the patient reduce anxiety and find effective methods of avoiding stress and getting around problems. If these factors are solved, the individual's sexual activity may be significantly improved. Exercises to treat premature ejaculation at home. There are some exercises that can help men to better control his erection. They basically consist of training the cessation of sexual stimulation before ejaculating. Start and stop technique, in which the penis is withdrawn from the vagina for a few minutes and then reintroduced. Tightening technique, in which a pressure is made on the glands which, in addition to interrupting sexual arousal, would reduce penile stiffness. Anxiety is the rule when dealing with fast ejaculators. Any kind of activity that can generate relaxation is valid. Many practitioners recommend, along with basic therapy, yoga, acupuncture, Pilates, music lessons, painting, and other activities that keep the individual from everyday routine and stress. However, the caveat is the same as mentioned previously, not as a single therapy. Therefore, the basis of the treatment of premature ejaculation is in the psychological support. Medication that acts in the brain where the ejaculation control nuclei are located, and measures to reduce the origin of excitatory stimuli in the penis. Medications for premature ejaculation. The most commonly used medications for the treatment of premature ejaculation are anafranil, clomipramine. Only a doctor can tell you which drug is most appropriate for your case, as well as the correct dosage and duration of treatment. Always follow your doctor's guidelines carefully and never self-medicate. Do not stop using the medication without first consulting a doctor, and if you take it more than once or in much larger amounts than prescribed, follow the instructions in the package insert. Home remedies for premature ejaculation. Erection occurs primarily because of the directing of the blood to the penis, which fills their corpora cavernosa and gives support for the organ to become erect. Therefore, it is believed that foods that stimulate circulation can help in cases of premature ejaculation. However, since the problem is multifactorial, they are not guaranteed. Garlic has several interesting properties for health, including sexual health. It has an anti-inflammatory, antibacterial, anticoagulant action that is also attributed to aphrodisiac properties. Its anticoagulant action improves blood circulation, which can be reflected in the erection, says nutrologist Andrea Guarnieri. Saffron, ginger and milk. Drink milk serves more as a base for this blend, but the two spices have functions that justify being singled out as home remedies for premature ejaculation. Saffron has great prestige as a sexual stimulant in the countries of the East, because it has a vasodilatory effect, besides supposedly promote increased sensitivity of the genital region. Ginger also favors circulation of the body, also helping to improve the quality of the erections. Seek baths with rosemary. Relaxation is key for premature ejaculation sufferers, so Nutricer Andrea believes that rosemary baths can be a good home treatment. Rosemary is known as invigorating, and sitting baths with fresh rosemary help to sedate the genitals and promote physical and mental relaxation. Good. This was the video about what is premature ejaculation, home treatments and how to avoid. But if you want to get your problem over with, go to link in description of the most talked about 100% natural method video that has helped thousands of men overcome premature ejaculation. And that was the video. I hope you liked it. If you liked it, leave like, and if you are not registered, sign up and activate the notification box to receive content like this. Have an excellent day, and until the next video.